Next here on the Town Hall, we want to talk about some new research being done to try to knock out two nasty viruses for young kids, rotavirus and norovirus. The last one is more commonly known as the stomach flu, but both of them cause similar symptoms: vomiting, diarrhea, in severe cases, dehydration. There has been a vaccine for rotavirus for about 15 years, but none exists for norovirus. One expert is trying to change that with a 2-for-1 vaccine to protect against both of them. And that very researcher has some new motivation. She just recently became a new mom, and she explains to us tonight how the vaccine would work.
When this recombinant rotavirus grows, it will be expressing the norovirus protein as an additional protein. So this vaccine will be able to give protection against rotavirus as well as the norovirus at the same time. In other developing countries, the medical system is not that great. So even if the child is getting an infection and taken to the hospital, we could not say that every child could be saved. So vaccine is the greatest idea for saving the life of the children in developing countries.
Norovirus infections kill about 100,000 children around the world each year, almost all in developing countries. So let's talk about this now with Dr. Michael Zang, Associate Chair of Pediatrics for Catholic Health, who joins us now live. It's great to have you on, sir, and I want to start with kind of your reaction to this news now and the possibility of this 2-for-1 vaccine for these viruses. And considering all the discussion about effectiveness of like the COVID vaccines, I wonder if we have any idea how effective this could be for kids once you're able to actually get this in arms.
Well, good evening, Michael. Thank you for having me. I think it's hard to be certain of any particular outcome at this point, pending, a rigorous scientific inquiry, which is the time when we can draw strong conclusions on something like this. But that being said, I'd be hopeful that this is going to be a highly effective vaccine. And the justification for that is looking at the history of vaccines. There are numerous vaccines out there generated in a variety of platforms that have proven efficacy and safety over and over again. And I think in this case, the most prudent thing to do would be to look at the vaccine you mentioned, which is the vaccine for rotavirus, which has been out for approximately 16 years and has demonstrated in the department of a 90% reduction in disease burden, hospitalizations, and those seeking care.
In places with good healthcare systems, like here in the United States, thank goodness, kids don't usually die from a virus like these. So would vaccination be more about lessening the symptoms for them? And how serious can these be for young kids?
I think there's no question that when you look at this, a vaccine that's aimed at a severe gastrointestinal disorder, it's going to pack the most punch when you go to a resource poor region. Those are areas that are going to lack the things that sometimes we take for granted: supportive care measures, IV fluid, oral rehydration, which is right down the street at your local pharmacy. When we look at the pre-vaccine era for rotavirus, worldwide, we saw something in the order of 500,000 deaths for kids under 5 years of age annually, as well as in the neighborhood of 2 to 3 million visits to healthcare for concerns related to it. So I think when for rotavirus, it's a no-brainer. For norovirus, certainly the mortality is much smaller, although it's not zero. And that doesn't take into account that the morbidity is a real issue. In the US alone, annually, there's about 20 million cases of this disease. And of those folks, several million do seek care. In our hospital alone, in Catholic Health and the Mercy Emergency Department, we're seeing quite a number of cases of gastroenteritis. And I'm sure that's true across the region. While that doesn't necessarily translate into death, thankfully, it does have an impact on quality of life, missed school, missed work, risks to those who aren't vaccinated or who are immunocompromised, not to mention the cost alone.
Yeah, I mean, lessening the burden from these kind of viruses, I think, will perk anyone's attention, because over the past few years we've talked so much about, COVID, but people are still getting these other illnesses, and you're right. I mean, they can be such a burden. Finally, I want to ask you about, looking forward. I know this is, at a point in a process, right? What comes next, and what do we know about how quickly something like this can get approval and actually be used? I mean, I read today this researcher's been working on this particular kind of 2-for-1 vaccine since 2016. What do we know about the timeline?
Well, I think she's making good time. I mean, I'm going to make the understatement of the year. Vaccine development is a daunting task. I think that, we're fresh out of COVID. And so right now, I think that is our point of reference for vaccine development. And I think what we saw there was that expeditious development was an unprecedented event, and probably was a product of, a unified political agenda, a major influx of cash, a concerted global effort, and probably just a touch of fear, which is how I do some of my best work. But I think that, even with all that being said, that product came out. It was an emergency authorization to begin anyways. It didn't have any long-term data. It's not really the standard by which you produce a vaccine outside of the context of a pandemic. It's great for a pandemic, but I think outside of a pandemic, I think that it's fair for this process to take years. And depending about the challenges along the way, I think a decade is reasonable too.
Yeah, something we will continue to follow closely, because again, these viruses are just so ubiquitous. I know every parent watching right now is interested in this topic. Dr. Michael Zang is Associate Chair of Pediatrics for Catholic Health. Thanks so much for coming on. It's good to see you.
Thank you.